will be the infection getting passed onto the children, given that the mother may not even realize that she was infected. So, this is how syphilis is mutating in Seattle. Yes, it's probably mutating and happening like this in ways that we don't even know about yet all around the world simultaneously. However, YS is a 32-year-old man presenting to the emergency room with fever, dysuria, and purulent urethral discharge.
Wow.
He tells the admitting nurse that he had an intense pain between his legs due to an ulcer on the shaft near the head, and that all of this came just a few days after meeting and intimately interacting with a woman, different than the woman who he lived with and he normally interacted with.
Wow.
The medical team asked some more questions, and they found out that that woman...
Wait a minute. So, dude done got, like, basically a bump on his penis area from interacting with a female that he don't normally interact with. Now, that's right there is just crazy. First off, family, kinfolk, this is Xxaattle. I'm in the building, up in the place to be. Appreciate you guys for coming through and checking out this content. First off, why are you messing around with a said female that you haven't vetted out? Why are you poking around with a female that hasn't been vetted properly? Like, what? And secondly, if you gonna just be, humping around, you know what I mean? If you gonna be just humping around, why not use protection? Like, I'm trying to figure out, like, let me ask you, chat, family, folks out there, do you and will you hump around and mess around with females that you don't know, you just met, and you not even gonna use a condom or any type of protection? Man, this is crazy. It's starting off wild.
He lived with was HIV positive.
Holy shit.
At admission, a blood test reveals that YS has an HIV viral load of more than 10 million copies per mil, and his CD4
I don't know what
count
that
was
is, but it's a
400,
lot.
normal range between 500 to 1500. This is sufficient to make a diagnosis of acute HIV infection, but more was happening. High-risk behavior with penile ulcer and urethral discharge mean co-infection with another
Hold up. Penile ulcer and discharge? Oh, this dude, he about to fall apart, family. This is crazy.
But which one or ones? Testing returned negative for gonorrhea and chlamydia. The urethritis was thus non-gonococcal. Based on his presentation and on treponema-specific antibody test, YS was found to have primary syphilis.
What?
Intimate human contact involves significant exchange of microbes. Ones that aren't part of normal human microflora can cause significant disease, one of them being Treponema pallidum, the bacteria responsible for syphilis.
These
what
are
YS
words I don't
has
ever
been exchanged
want
person to person for thousands of years, but most well documented on paper starting 500 years ago. In 1494, King Charles VIII of France took French troops and mercenaries.
I seen a female post her tongue looking just like that tongue we just saw. And she said it was whatever she said, but she said it was something. You get me? I don't know what she said it was. Hold on, let me go. Let's keep it pushing.
To Italy. He was offered the kingdom of Naples by the Pope because the king of Naples refused to pay feudal dues to the Pope, and King Charles's grandmother was from the previous ruling family of Naples. The king of Naples and the Pope had reconciled before the Pope died, but then the king of Naples died too, and an ensuing succession crisis led to Charles's invasion. Armed conflicts imposed ravages, and this was no different. King Charles's army camp started to notice that their men were getting an illness that would cause them to become disfigured. Doctors hadn't seen an illness like this before, but it was spreading. When his army returned to France, this strange illness followed them home, and this disease spread all over. The age of...
You know what, family? This is one way to defend your country. You know what I'm saying? If somebody invading, you could just set them all up with the syphilitic concubines, surrender and then let them go on their way, and then just let things play out. You get that's one form of defense.
Of syphilis had arrived in Western Europe. And this
Wow.
historical context is important because the general course of illness hasn't really changed in the last 500 years. There's an initial infection that appears a few weeks after contact that's usually visible in men and can be hard to visualize in women due to differences in physiology. And it may or may not be painful in both. There's a latent phase that then becomes much more severe as an illness encompassing multiple organ systems later. And without treatment, this will cause permanent damage all over the body. So when we say disfiguring illness, what are we talking about exactly? Well, during the contact when
Oh my
Treponema
God.
pallidum is
What the?
acquired, microabrasions can
Is
develop
her
at
nose
those
gone?
points of contact.
See,
The
that's what
bacteria
I'm saying right
enter
there. Like if you go on Instagram, it's a female that posted her tongue looking just like that, family. Her tongue looked just like that. People was like, it's herpes. People was saying all kind of stuff. But what I'm getting at is there's a new form of syphilis, and it's you know, it's becoming other things. I don't know what the word is, but I forgot the word. It's mutilating into different stuff, family. So be careful out there. She got a video just like that. Look it up on Instagram.
and then creates a chancre. We have a pretty good idea of how these microabrasions happen. In the male case, it's going to be visible, but truth be told, anywhere that has contact
Truth
with
be
someone's
told.
lesion, especially mucosal contact, can initiate acquisition. The spiral-shaped bacteria has arrived. At first, it replicates slowly, but then it
Ideo,
forms the lesion,
it has
and then
arrived.
it spreads throughout the entire body. At first, the immune system takes care of this. It produces antibodies, and the person appears to get better. The lesions start to go away. However, the problem is, for YS, his immune system is now compromised because at the same time of his syphilis diagnosis, he had acute HIV, with blood tests confirming that his immune system cannot operate at full
Wow,
function. All of
wow.
this
Hold on. This gets deeper. So it's a guy out here with acute HIV sleeping around with somebody that got syphilis, and neither one of them, or a new form of syphilis, and neither one of them was telling each other. Or maybe you know how you make a soup in a pot, maybe the HIV coming together with the syphili created this new form. Ain't no telling, family. That's crazy for you to be running around here with HIV. You get me? Acute HIV at that, sleeping around on a first date without fully vetting somebody, without protect this. Ooh. I picked a fine time to stop doing heroin. All right, let's keep it going.
explains the lesion for YS on the shaft at the head. Other than the symptoms that he presented with, everything else seemed okay. If syphilis is caused by bacteria, then an antibiotic should be able to treat it. In the hospital, YS is given pengbenzethine injection, and he's
What the
given
hell?
additional
What
doxycycline
the
antibiotic to be taken for 6 days upon discharge. They scheduled him to return to the clinic for follow-up so that they could confirm by blood test that his syphilis had been taken care of by the penicillin, but he never showed up. As the months passed, YS seemed to be okay, but around a year after getting that chancre, he started noticing severe upper abdominal pain on his left side. He was
Wow.
told to go to the emergency room to get treatment, but in his mind, they didn't fix him the first time. They clearly just want to make more money off of him and have him keep coming back. So he promptly
You know, we're gonna continue fast, but a lot of people are scared to interact with the doctors because of stuff like this. You know, they like, yo, just like with your car, you be like, I took my car to the mechanic the first time, they didn't do nothing. I ain't finna take my car back to that same fool again. So I get where they coming from, family.
declined, but a few more months at home and things didn't get any better. One
Mm,
morning, YS woke up and everything in his field of vision was blurry,
mm.
knowing that the first emergency room that he went to, obviously, in his mind, didn't do anything. He went to a different one where they gave him some antibiotic eye drops to try and help clear some things up, but they didn't help either. 2 weeks later, YS woke up and he couldn't see at all. Over the last 6 months, YS had had
Wow,
severe bouts of
blinded?
nausea and
This is
vomiting. He'd
crazy.
feel abdominal cramps on his left side, and these would squeeze so hard. He'd huddle over in his chair. The pressure he'd get in his head from holding his
Damn.
breath to try to make himself feel better would end up making it feel like his eyes were getting pushed out of his skull. He'd grab his
Ouch.
side, begging for it all to stop. But as the days passed, when he stopped
So if you starting to have these type of symptoms, family, folks, kinfolk, just know what you're going through. You experiencing a mutilated type of possibly STI that we've never even experienced. And get to the doctor quick and don't spread it to nobody else.
eating, he didn't have as much to grab onto his side anymore because he had lost 40 pounds. He didn't want
Wow.
to eat, and he couldn't hold anything down.
Wow.
Back in the emergency room, again, doctors noticed that in addition to stomach pain, YS
That's
had lesions on his
crazy.
scalp, and he had been losing hair. A blood test finds that the HIV viral load had
You know how I
decreased
feel about
to
my hair.
40,000 copies per mil, but that his CD4
I'm
T
not
cell
trying to
count was
lose no more
244.
hair. I'm not
Ophthalmologic
trying to
exam
lose
finds that his right eye
no
was 20
more
over 400
hair.
and his left eye could only perceive light. CT scan of his head didn't
Wow.
reveal anything,
Wow,
but when they
dude, going
analyzed his
blind.
cerebrospinal fluid, they found low glucose, high protein, and high nucleated cells.
Spinal,
It
how
was
do you get
negative for
spinal
treponema.
fluid?
This doesn't necessarily mean that he doesn't have neurosyphilis. The
What
test
the
is not 100% sensitive, so he might
hell?
actually have something happening, but they need to look deeper to know for sure.
Mm,
But what the
mm,
medical
mm.
team does know for sure is that YS has nodules and ulcers in his GI tract because esophagogastroduodenoscopy revealed them. Biopsy of his lesions found inflammation, neutrophils, and granulation tissue. Immunohistochemistry didn't find Helicobacter pylori,
What
meaning that these
the?
weren't peptic
These are
ulcers that you
words you
normally
don't want
find.
to know
Rather,
about,
the
family.
stains found
These are words
spirochetes
you do
consistent
not
with
want to know
treponema
about.
pallidum, meaning that he has syphilitic ulcers in his stomach, causing his abdominal pain, his nausea, vomiting,
Syphilitic
reluctance to eat,
ulcers in your
ending with 40-pound
stomach?
weight loss over the last 4 months. The syphilis had spread to his eyes and to his stomach.
Oh my
Didn't his
God.
body cure the
Oh
chancre
my
when he was
God.
first infected? Why is syphilis in parts of his body distant from the original lesion?
Mm,
The immune
mm,
system
mm.
response to treponema pallidum is a paradox. On the one hand, the immune system handles the original chancre and the patient appears to improve. But during this time of improvement, the bacteria is replicating and spreading all throughout the body. This first wave
Wow.
of illness is called primary
Wow.
syphilis, but a second wave can appear as secondary syphilis, where acute manifestations can reappear and then
Wow.
sometimes disappear. In some cases, primary syphilis isn't even noticed by some patients because the symptoms aren't painful.
Mm,
And
mm,
chancres
mm.
often aren't painful. And sometimes, if or when they get noticed by the
What
patient,
is
no treatment is sought because it doesn't hurt. It just looks a little weird. And this could increase the chances of transmission.
Wait. So if you got some type of skin irritation going on that don't hurt, but it's just weird, you not thinking about possibly dealing with this is crazy, family.
To
We
others
dealing with a
because the patient
wild
may
group,
not really
family.
realize what's happening to them, and reemergence of symptoms following a latent phase could then make the severity of disease worse. And
Imagine
this is
if you
assuming that
woke
the
up
patient
looking
is
like that. You wouldn't do
immunocompetent.
nothing?
But given that YS had a diagnosis of acute HIV several months ago when he first presented to the emergency room, and that his CD4 count was still low, he's likely to have more severe disease. YS was considered to have gastric syphilis, and with ophthalmologic involvement and CSF markers, he was also diagnosed with neurosyphilis. This warrants
Wait,
penjibenzethine treatment
so
for 14 days
gastro and
every
neuro,
4
that's
hours
like
with
stomach
concomitant antiretroviral therapy for his
and the
worsening
rest
HIV
of your, he
infection,
just got
all during
syphilitis
hospitalization.
everywhere.
Gastric and neurologic
Damn.
involvement of syphilis is disseminated, but the medical team had obtained a gastric biopsy. They also got one from his colon. When they further examined these, they were able to sequence the DNA of the
I'm
treponema
sure his
pallidum,
colon
and it
probably
was
got
here where they found that something was
biopsed
wrong.
that night
Typically, when we see
when he
someone
first caught
infected
the
with syphilis,
infection.
and if we're able to get a chance to sequence the genome of the bacteria that's infecting that person, the sample will usually just have one particular strain of treponema. That's the one
Tripahuma?
that infected them. That's the one that's growing and spreading in their body. There's decent records of treponema strains where certain geographic locations will have trends. One strain is found.
Hold up, family. Look at that map. Offer syphilis testing to all sexually active people 15 to 44. Even in, look at suppressed. Look at the suppressed areas. The Midwest, they probably, what's going on there? But Cali popping. Cali popping. Damn, family. Look at Seattle. Look at, oh my God. Look at the map. Look at
More
the
in one
map.
continent than the other. And this makes sense because of this particular organism and how it's spread amongst humans.
It's been
The
around for a
problem
while
with
if they got
YS's
like
sample
pictures
is
like
that the
that of
medical
it.
team found two different strains of treponema,
What?
meaning that he has a co-infection with two distinctly different kinds of syphilis.
Holy
It's
cow.
unclear if he was somehow
Holy.
infected twice, so
What?
we would say that he acquired both sequentially,
Oh my
or
God.
if they were co-transmitted,
He was at
meaning
a
that the
Diddy
person that he
party.
got it from
This thing-
also had both of these together. One thing about treponema is that it can't be grown in a petri dish. It dies without
Hey,
the
it
proper
ain't.
nutrients of which
It
is
ain't. I
found
ain't.
when it
This
lives
ain't
inside
funny.
a human. So sometimes you might find people that will try to categorize treponema as a parasite, but really it's still a bacteria. And this is why it's very hard to detect directly. You need the antibody tests. One thing that highlights this difficulty is how treponema pallidum is studied. The first time the actual bacteria was described, despite this infection being known since at least the 1490s,
What?
was when in 1905,
This
German
been around
scientists were the
since
first to find the spiral-shaped bacteria from the
since before
cerebrospinal
Biz
fluid of a
began.
patient.
This been around
7 years later,
forever.
American physicians working for the government were able to isolate and keep one particular strain of treponema pallidum by doing this. They took the CSF of a neurosyphilis patient and injected it into a rabbit.
This
At
been,
least since
oh, that's
1906,
cold, man.
scientists had known
That's
that rabbits
cold.
and hares could get
That's cold. I don't believe in animal abuse, but them is some big ass rabbits. I'll tell you that. Them rabbits is big, family. Look at them big rabbits. Or a hare, or what? Them things is big, family. But that's cold. That's like animal abuse. That ain't. That's cold. That's just
similar infections that humans would. Knowing that the human patient's CSF had treponema in it because he was infected and had neurosyphilis symptoms, they transferred the bacteria to rabbit testes to replicate the
neurosyphilitis
bacteria.
barbae.
If it won't grow in a dish, grow it in a living being. One of the doctors who did this was named Nichols, and so thus the syphilis that was replicated in that rabbit
That's
was
the
known
guy,
as the
Nichols.
Nichols. It's a little different now. One sample was taken from YS's colon.
What?
There, they almost found exclusively what they thought was the Nichols clade of treponema, but something was wrong. In 1977, more than 70 years after Dr. Nichols and Dr. Huff had isolated the Nichols strain, staff
Wow.
members from the Centers for Disease Control in Atlanta
CDC.
isolated another strain of treponema pallidum
Why it gotta
that they
be
would
in
call
Atlanta?
street strain 14.
Why it gotta be in Atlanta? Why they gotta find a new strain of syphilis in Atlanta? This is crazy. Be careful for all my Atlanteans. Be careful.
Or SS14. By this time, the Nichols strain was the oldest available strain that was isolated within a few years of
Wow.
identifying treponema as the causative agent for syphilis. Nichols had been the most widely studied strain. When bacteria infects another species of animal, you can expect that it's going to mutate. Back in 1913, they weren't able to sequence DNA. Actually, they didn't even know double helix structure back then. But in 1956, a study was done where human volunteers were purposefully infected in a lab with Nichols strain treponema.
Wow, this is that Tuskegee Airmen experiment. You get me? Like during the Tuskegee Airmen experiment, they purposely infected these folks with syphilis. It was with the hope of answering some of these questions that the present study was undertaken for it had long been felt that the resolution of some of these problems would depend on planned experimentation in human subjects. This is crazy. It was some volunteers from Sing Sing prison, yeah, and Tuskegee too, family. This is cold. These scientists is mad.
pallidum,
There
and
go
it
their
was
names
confirmed
right there.
moving it to
Evan,
rabbits
Sydney,
didn't impact its
Alansky,
infectivity in
Kaplan.
humans. This kind of study is unethical. It did tell scientists
Unethical,
at the time that
family.
the nickel strain was still relevant for study. But even more unethical is not communicating the purpose of a study to humans and then denying
Period.
them treatment in the name of documenting the natural history of a
Period,
disease.
family. This
And
is
this was known
cold.
to have happened with the Tuskegee syphilis study.
Yeah,
And patients
I
weren't
knew
told
it.
that
The
they had
Tuskegee.
syphilis. Another experiment happened in Guatemala where they were deliberately infected with syphilis. And the effects of these kinds of studies being so unethical, they still linger today, where there's limited trust
This
in
is
some
cold,
clinical
family.
trials. You can't blame
This is
people for
cold.
not trusting this when this happened. I did
And this is the reason why people don't trust going to the doctor, or if they go to the doctor one time and it don't work out for them, that they don't go back, family. This is part of the reason why. Like, look at this. You might become a guinea pig or a guinea hare.
talk about another clinical trial problem similar
This
to
is
this
crazy.
in an episode of this podcast before. There's some paid organizations that want to reform how certain trials are done. But don't forget, those reforms will always create a different set of problems because you're dealing with people, and people are infinitely complex. Having a second reference strain from a strain that has some significant differences could be important to keep track of how things continue to change.
I was just talking about about the complexity of human beings with a friend of mine, and they trade on the stock market, and I was like, my thing is that if you can predict the tendencies of humans, then you could successfully predict the stock market. Because to me, and this is my personal opinion, this on a whole nother subject, the stock market, the way that it fluctuates is really based on the tendencies of humans. So anyway, I just wanted to throw that out there. Let's continue. Let's
Change over
continue.
time. And the problem for YS was that when the medical team did the sequencing, they found exact genes that were associated not only with the nickel strain, but also SS14.
Wow.
Usually, when someone is infected, they just have that one strain of treponema,
Wow.
but YS had two.
What the
So
hell?
either he was
Two?
infected more than once, or he got infected with both strains at the same time. It's not to
What?
say that this hasn't happened before, but this hasn't been documented or seen before.
This
Interestingly,
is
in Seattle,
crazy.
where YS was, the SS14 clade treponema was known to be collected from heterosexual patients at that time during the years of 2021 to 2022, when he was most likely infected. But the Nichols clade during that same time, in the same area, had only been collected from men who had male partners.
So this dude was this YS. I'm not saying it was it was a male because he had a. So you saying this dude was trisexual? He just willing to try anything. It don't matter. It just I'm gonna try it. This one trisexual.
Despite YS's history only mentioning
I don't know if I
female
could say
partners.
that. Presumably,
In 1998,
he
85
was
years after the Nichols strain was
tried,
isolated, the entire
willing to try
treponema
anything.
genome was sequenced from that strain. Scientists had developed the techniques to do it without sacrificing countless rabbits, though they had to sacrifice some for this particular study.
Wow, I
In
feel
the
sorry
genome,
for
they
the rabbits,
discovered why
family.
treponema
I feel
pallidum
sorry for the
couldn't be
rabbits.
easily cultured because it
This
can't
is
make a lot
crazy.
of its
The
own
rabbit's
nutrients.
losing his
They found
hair.
that it has
Rabbit
similarities
don't know
with
what's
the
going
bacteria that
on.
causes Lyme
This is
disease.
crazy.
They were able to get an idea of why it could evade the immune system for so long following the first immune response. And they were able to find out how and where penicillin would bind to destroy it. YS's colon mostly had Nichols strain, but the
Told you
scientists
when they
noticed
start
something.
talking
A
about that
protein that
colon,
probably
I
transports
already
fatty
knew
acids is
he
encoded
was
by the
doing
gene
a little bit more than the
TP0865.
ordinary.
When they looked further, they identified variants. Parts of the TP0865 gene that's associated with the Nichols strain were found mixed with other parts of the SS14 strain.
Wow.
Some parts of the gene also had
Wow.
substitutions in the amino acid sequence. In the stomach sample, another gene called TP0705, which encodes for MRCA, a penicillin-binding protein, was identified. Transfer from the nickel strain was found in the SS14 strain with a new mutation never before seen at amino acid 478, where a methionine was present instead of a valine. The DNA found here indicates that part of the nickel's DNA was now in SS14 in YS's stomach. Multiple other genes, of which their sequence is up to date in the region, were found to be recombined in YS's stomach sample. All of this meaning that for the two strains of treponema inside his body, it appears that they may have been mixing their DNA together, creating a recombinant treponema pallidum. In the last several decades, scientists have been documenting how this bacteria and its various strains have been changing over time. At the population level, the bacteria was known to mutate very slowly, with one nucleotide change every 3 to 7 years. However, the number of syphilis cases has been increasing rapidly over the last 10 years in the United States. And despite YS's case being the first documented co-infection with DNA recombining occurring between both strains, it could mean that treponema pallidum might be on track to change at a different rate now. Street strain 14 was sequenced in the first place because doctors started noticing that syphilis was becoming resistant to antibiotics. The issue was the kind of antibiotic.
See, SS14, street strain 14, street strain 14? They found it in 1977 from an infected human. Oh my God. Why is the sexually transmitted disease laboratory in Atlanta? And this is where all the wild stuff be happening.
Back then, macrolides were used to treat the disease. These medicines inhibit bacterial protein synthesis by binding to the 50S ribosomal subunit. These medicines come in tablets, and they're convenient for patients to take when they're not in the hospital because PenG needs to be injected. The problem is, all syphilis is resistant to macrolides now. However, despite being used for decades,
did you see all? They had a lot of that in Wisconsin.
Has not developed.
Did you see that chart? That Wisconsin?
And the V478 mutation found in YS's body didn't appear to be clinically significant. There was no evidence that it conferred penicillin resistance in the individuals who had it. However, it might only be a matter of time before a mutation does appear that does enable that resistance. It has happened with macrolides. The one thought that I had about this particular paper is that when you look at CDC county-level syphilis data, you'll notice that Seattle or King County doesn't really...
Hold up. Secondary among women ages 15 to 44. This is 2023, family. This recent. King County, Washington. Look at LA, though. I know right where Kings County, California is. I know right where that is. Okay, they offer testing. All right.
Really have that high of a primary and secondary syphilis rate
This is crazy.
in women. Done this way as to be able to tie it to congenital syphilis. It's
They not worried
22.5 per
about Cali.
100,000 people. If you look at neighboring Snohomish County, it's less than half at 9.4. Seattle King County's rate is hardly the highest in the country. You can find other metro areas smaller than Seattle, like Cleveland-Cuyahoga County, that has 19.8. Atlanta's Fulton County has 23.4.
Fulton
St. Louis
County, look
City
out.
has 66.7, but St. Louis County has 19.9. If you want to see something that we definitely don't hear about every day,
Hey, them
it's that
three, be
places in
careful
South
out there.
Dakota
Stay strapped.
have rates of more than 2,500, more than 100 times that of Seattle.
Wait. South Dakota? What the fuck?
Happening on Native American
What the hell?
reservations. And it's not just one county. It's very many parts of the state. Actually, parts of the region spanning into Montana and North Dakota, too. Now, these places might actually have less cases simply because there's less people here than in a place like King County. Perhaps New York's rate is only 6.5 because it has more than 10 times more people than Seattle. So, by a pure number standpoint, there are more cases in New York despite a lower percentage or incidence rate. When we're thinking of mutation and recombination and things that have only been documented to be happening for the first time now, we have to remember
this syphilis could mutate into anything. It could mutate into
before and is happening in many places now all around the world. There's an
Jesus.
estimated 8 million people who got syphilis around the world in 2022. There's probably
What?
more than that, because think about this. The nature of the disease may be perceived by the person to be embarrassing, or they just don't want to deal with judgmental people and having that attitude. This will make it harder for them to want to seek treatment. Even YS kept leaving the hospital against medical advice and would tell the new emergency room that the sore on his leg was because of his spider bite, not because it was syphilis. While the history had noted a few points about what had been going down, there's no way for any person on the medical team to confirm absolutely YS's history. And if he doesn't want to divulge that information, then he doesn't. The final point about this is that in the United States, there's been a shortage of Pen-G.
Wow.
It's actually been ongoing for many years now. We've
Wow.
actually been having nonstop rolling
They
drug
so busy
shortages
making
since at least
the
2010.
VAD
Currently,
stuff
Pen-G
that
in the
they
United
just
States
skipping on the
is solely
Syphilis
licensed to the
loci.
largest company
You get
in
me?
the space. And there's no generic
Shame on
versus
you,
brand
Fi.
issue here. It's just one brand. Pen-G isn't a tablet. It's an injection. The sheer volume of
Damn,
liquid that gets
3,000
injected into a
what the
patient
fuck?
with syphilis
It's
can kind of
3,000
be
a
shocking
pop?
the first time you see it. And this injection is
Oh, a
painful.
lot of people
It's
gonna be getting
daunting.
this.
It's deep into the
A
muscle,
lot of
and it's in
people.
a place that feels really weird. And I don't
Ouch.
know how the events of 2025 are going to disturb the supply chain, but in 2024, the FDA did take some measures to try to alleviate some supply chain.
Family, I'm gonna say this: with all this supply chain issue going on, you need to protect yourself at all costs, because if you get a form of this mutated syphilis and they ain't even got none of this biocillin parts, your nose just fall off. Protect yourself out here, family, in these streets. Protect
Issues,
yourself.
especially when cases have been increasing. But what's going to happen to surveillance and testing programs? Good question. So the few things that we do know are this. First, syphilis cases have been increasing in America. They're increasing in other countries too, on a trend that started pre-pandemic. The second is that the bacteria that causes syphilis has been changing. It's radically different now than when we started
What
documenting
the
it in the
hell?
late 1400s. It appears it was much more severe back then versus now. We've really only known about Treponema pallidum since 1906, and we've known the whole genome since 1998. However, in these ensuing almost 30 years, we know that this bacteria can change on its own. Random mutations intrastrain were found in YS, but now we know that
This
interstrain
thing can
recombination is possible in the setting of
inter is like international, so that's body to body, and then intra is like the contiguous 50 states, or 48 states, all that touch each other. So that's the difference between inter and intra. Think about that.
infection. High case burden now versus before means that the likelihood of multi-strain infection is increased, and that people may be creating new strains of Treponema pallidum that will behave in ways unknown to us now. This can change its virulence. It can change transmission patterns. It can
Changes
change the symptoms that
virulence.
can develop, especially when HIV is involved.
God.
And it can deeply impact how it's treated if a mutation that confers penicillin resistance emerges. There's going to be people who are going to dunk on the folks who get this, but you have to remember, many
Man, that
times
look
the initial
nasty
infection
and
is
scary,
asymptomatic.
both at the same
Especially in
time.
women, they might not even know that they have it because a painless chancre might be growing inside their body, not easily visible. And the tough part will be the infection getting passed on to the children, given that the mother may not even realize that she was infected. So, this is how syphilis is mutating in Seattle. Yes, it's probably mutating and happening like this in ways that we don't even know about yet all around the world simultaneously. However, it was documented here first during a time of rapidly increasing infections. Thanks so much
Wow,
for watching.
family.
Take care of yourself and be well.
Wow, family. Wow, family. This is incredible, family. I mean, this is totally incredible. I can't even begin to comment on I can't even begin to comment or even think about the severity of this disease that's going on and taking place. But I can say this: you need to protect yourself when you out there. You need to properly vet. You need to properly check your symptoms. You need to 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 these males or females that you intertwine with sexually, and you need to keep yourself checked up. Because I'm saying, like, how can a person with HIV be sexually interacting with somebody else without protection, man? That means that these people, they don't have no type of humanity within them, no conscience, no empathy. You get me? None of that is there, family. Neither one of the two that came together. And that created some evil. Anyway, family, thanks for watching. Please hit the like button down there. Comment on what you liked or disliked about the presentation, and hit the notification bell so you can be hit up next time we create a video. Xxaattle in the building. We out of here, family.